I've said earlier on, she has some acne scarring and then some melasma on the face, and also I was told that she has silicone injected into her nose. She's of skin type 5, so we have to be a bit more careful.
But generally speaking, this is low quality epidermis. This is one thing that we would like to improve. Second, around the eyes, they are much more wrinkled, so we can use the different modalities of the Tixel in different settings, and we're going to apply different topicals, so we are going to have good results. Again, it's not one treatment, it's several treatments, but you can get really nice results.
As the patients get older, I like it to be longer duration between treatments because the ability to produce collagen is slower, and I found that if they delay the treatments 6 even to 8 weeks, they get more out of each treatment. Okay, we'll do the periorbital first. So just 3 settings, as I said just now, just the exposure time, the protrusion, and the pulse typing. For her, as she's skin type 5, I'll just use 10-500. That should be enough, and just single pulsing. Double pulsing is more painful, whatever setting it is. So as this is periorbital and she has no anesthesia, I just use 10-500. And you can see the temperature here is 391 degrees. So anything above 385, that is equivalent to CO2 laser. And here there's a pulse count. So we can see that they're just trying it for 3 pulse count. And when you press this button, there's a total number of pulse that has been used on the treatment head. Okay, so I just press confirm and it's ready to go now.
Okay, may I ask you about the unit of the pulse duration? Is it?
Millisecond.
Millisecond,
Millisecond,
right?
yeah.
And the next, the 500 microns.
Microns, yes, microns, correct. Yeah.
And when you say the double pulse, it means that it delivers each of 5 milliseconds? Or?
That's right, it's 10-500 doubles. Okay, this is single, so you can see it just come up and go back once.
That's right.
This is now set to double, so you can see it's going to double tap it. Can you see that?
Yeah, very fast.
Yes, very fast, double tapping. But even though it's fast, it will take it to quite a few milliseconds more. And we know that after about 20-25 milliseconds, people start to feel pain. So whatever setting it is, it's better to do single pulse at higher setting. That will be less painful than even a lower setting at double pulsing.
You recommend the single pulse?
If there is no anesthesia, I would recommend single pulse. But now I'm much more aggressive. I'm more familiar with the machine, and then I got skin type 1 and 2 in the UK, so I really just go crazy with it.
Thank you.
Okay. I normally just try a little bit further from the eyes just to get the patient used to the feeling. So here we go. Ready? Okay. And how painful is it?
No painful at all.
No painful at all. Okay, perfect. There you go. So now we can again carry on and just keep doing it. And you can go over hairs because hair is 2 or 3 millimeter down for the roots. So at 500 microns, it's not going to affect the roots of the hair. This is the periorbital treatment head. So there is a 4x6 arrays. And therefore it's rectangular and narrower. In some areas where it's more sensitive, you may want to go over it very quickly by just doing it like that.
Would you emphasize there are 2 hand pieces, one with a small spot size, this is the small spot size, and the other one is with bigger spot size, so you can use larger areas. So around the eyes, we usually use a small spot size with different energy, depends on what you want to achieve.
So when you apply the pulsar, you just put it next to it, no overlap fashion, right?
You can overlap. I mean, I'm confident enough with the machine that I can overlap. No problem at all. Just to increase the density. Each treatment is about 8 to 10% density in terms of fractional method. And also when I'm doing, you notice that I actually pull the skin up, so it's easier. I like it to be, the skin to be stretched. So we can touch the base of each part of the skin. And with this smaller treatment head, actually I can go down all the way almost to the lashes. As long as the patient can take it, we can go a lot lower. It's okay? Yeah.
again, we play with the device, and again, we discover more and more indication and application. So in the beginning, when I wasn't very confident, I used a very low setting and I used just one pass. But nowadays, while treating different indication, if I want to have more aggressive result, first I will, of course, increase my parameters. So I will go for more like longer pass duration and higher setting, and I will do double pass, or I will use the double stacking. So you can use different parameter again, depends on what you want to achieve.
To do the lower eyelid, I ask the patient to open the eyes and look upwards. Because when she look upwards, then the eyelash move out of the way, so we can go really close.
And I think one of the good thing of the Tixel is that it's not a laser, so no problem with the chromophore, especially around the eyes.
Yes, that's right. There is no chromophore, and also we normally, if I were to do this with CO2 laser, we have a metal shield for the eyes.
Yes.
To protect the patient's eyes, whereas with this is absolutely no worry. In fact, I ask the patient to open the eyes and look upward to remove the lashes away. This setting, by the evening, if my patients want to use makeup, they're fine.
Do you apply any material in your office?
Yes. What I do in my office is it's still hot. It's not painful, but it's actually quite hot. So normally I will spray some hyaluronic acid spray to just cool it down. I don't like to put moisturizer straight away because what oil does on the skin, it actually traps the heat in the skin, and therefore the heat feeling that the patient feels will last much longer. So I try to cool it down.
I'll show you with higher parameter because I usually use higher parameter in my clinic. And please have a look at the difference between the non-ablative and the ablative. So I just increase it from 10 to 12. This is one change, but you will see it immediately on the skin of the patient. And I will increase it just to 600 to increase the protrusion. Okay? So again, this is just one single pass. I will confirm. I'm just stretching the skin, and I'm going. Now it's going to be a little bit more painful. Can you see the channels? Try to get close with your camera. I'm going to make another one, and another one, and another one. Try to zoom in. It's very nice to see it. Can you see the channels on the screen?
Yes.
So these channels are open for few hours. So try to imagine on the potential. So we can put many materials. Dr. Harryono mentioned botulinum toxin, but we can use other material in order to improve our results. So I will go over all this area. I have to say that usually I'm staying approximately 3 millimeters from the eyelashes, so I'm not getting so close. But one thing that I do 2 passes. So on the lower eyelid, I do so. The picture that you saw, it's 2 passes on the lower part, but only 1 pass with lower setting on the upper part. So second pass. Of course, the downtime will be longer, so there are going to be slight peel out after this procedure. But the results are very, very impressive. Another 3 pulses, and that's it. All right? Try to get closer. Okay? You can see the channels. All this area was treated. Okay? In my clinic, usually I use some tretinoin on this area, so I think it improves the skin quality, different concentration. And while doing this treatment, I put some toxin, so it just opens the skin, so it makes the area very, very nice. It became kind of a classic treatment because we have many patients who come to us with a tear trough. So we fill it with fillers, and then I just top it with Tixel and some tretinoin in different concentration, and the results are very nice. It's just open the eyes, We have really elimination of the teardrop area, improvement of, there is some improvement in the pigmentation, improvement in the skin quality, and it gives us a very nice result.
So when did you apply tretinoin? Just right away after the treatment?
Immediately. We don't have the topicals here, but we do it immediately after the treatment. I just rub it into the skin.
And did you find any irritation of the tretinoin?
No, not really. In Israel, it's very common to use tretinoin 5% after certain procedure. So it causes some very nice superficial peel and improvement of skin quality. So 5% is 1,000 times higher than the recommended dose.
Yes.
And still there is nearly no irritation. So we leave it overnight. So my instruction is usually I put this material or any material. I tell my patient not to wash the treated area for 24 hours. And sometimes I provide them with some material to reapply at home. So they reapply it after 2 hours, after 4 hours, after 6 hours. Though I do think that it's like the channels are open even up to 12 to 24 hours, but we have studies still just 6 hours. So every 2 hours they apply the material, and they don't wash the face for 24 hours. And afterward they can use everything. The most important is sun avoidance and sunscreen. This is the main issue. I just finished the upper eyelid. Please notice that I decreased the parameters, so it's 10 and 500, one single pass, and here I'm going to do just one pass.
I just want you to notice as well as how quiet the whole machine is compared to my CO2, because when I use my CO2, I've got my extractor fan on, so it makes a lot more noise than this.
But I just want to show you other things. So again, regarding the face, so this is a classical patient. So what I'm going to do in her case, I'm going to do, but very low setting. Again, if it's melasma, we don't want to irritate the melasma. So it's going to be very low setting, the non-ablative setting all over the face, not with this tip, so with the larger tip, so we're going to have faster coverage. So I'm going to cover all the face, and on top of it, I'm going to so in the first session, I'm going to just put tranexamic acid. My protocol for such patients, so melasma patient, PIH patient, or mixed patient, so in the first week after putting tranexamic acid, I put some steroid, but very low potency steroid, so usually hydrocortisone 1%. In her case, because I'm not sure it's not ochronosis, I won't prescribe hydroquinone, but I will prescribe azelaic acid 15% twice a day. I will see her, this is a very nice comment from Dr. Harryono. Usually the older patient, they want to come sooner, and I'm trying to push the sessions apart. So every 6 to 8 weeks, and then we see really better results.
Okay, thank you so much for a very interesting and practical demonstration for Dr. Harryono and Dr. Ofir. Yes.
Can you just give us 1 more minute? We'll just show you the big treatment head. We'll just do a few shots with the big treatment head. This is for the larger areas. You can see now it's 9 by 9, and it's a 1 square centimeter space every time we do the treatment.
So the technique is pretty much similar with the tracking the skin and the stem.
Yeah. The stretching of the skin is just to make sure that we have a smooth surface. So it's always important to make sure that it's on a flat surface. Okay, thank you very much.
Yes, thank you very much. Okay, this is more or less immediate effect of the Tixel's